Hi, this is Dr. Faramaris Hidaji, and today I want to talk about a very common problem that patients are sent to me for in the office. It's called a stye. If your doctor has suggested to you that you come see me or another eye doctor for a very common problem, which is called a stye, this video is intended to teach you to treat this at home on your own so you can save yourself a visit and save yourself a copay. A stye is almost never a serious vision-threatening thing. Very rarely do they get infected. So it's one of those problems that if you're willing to be patient with it, almost always it will get better by itself. If you've been placed on an antibiotic by your physician, my suggestion is, unless he's absolutely sure that it's an infection, is to stop that antibiotic. These things, as I said, rarely get infected, and the redness and the pain that you get with them is simply your body trying to get rid of the stye. My suggestion to you is that you start using intense hot compresses, and hot compresses don't mean dipping a rag in hot water and holding it on your eye for a minute or two. It means intense, prolonged heat. And the best way to achieve that, in my experience, is to take a clean or preferably new tube sock, put rice inside it, tie it off, and you want it to end up being about the size of my fist, and putting it in the microwave for 1.5 to 2 minutes, depending on your microwave. Make sure it's not so hot that it's going to burn your skin, and then hold it on the stye for 8 to 10 minutes. You can sometimes reheat it if you need to, if the hot compress gets cold. After that, you want to massage it. Now, why does this work? It's because a stye is made up of oil that's trapped beneath the skin that turns hard. Just like you may have noticed if you take cooking oil and leave it in the refrigerator, or olive oil, it turns hard. This oil is supposed to be liquid. It's supposed to come out on your tear film, and it provides a very useful function of lubricating your eye and keeping your eye from getting dry. However, when it's too thick, it can't get out, and it starts to plug the pore that it's supposed to come out of, and the eyelid starts to swell. And it looks very serious, but it's almost never serious. You're trying to heat that oil to thin it, just like you would if you were applying heat to butter to get it to melt. And once you get it to melt with the heat, sometimes it'll come out on its own. And so you may wake up the morning after you've done hot compresses and notice you have a lot of discharge in the eye. That's from that melted oil that's come out. And that means that your stye is on its way to getting better. If that happens, I wouldn't stop the hot compresses. I would actually do more hot compresses to see if you could get through this without surgery. Now, let's say that you've done intense hot compresses for 2 to 3 weeks, and it really has not gone away. You're left with a painless lump that you can roll under your finger in the skin of the eyelid, and it just seems like it hasn't changed in several days or maybe even a couple of weeks. In that instance, it may actually require surgery to fix. But even in that instance, when patients come to me after just 3 to 4 weeks of hot compresses and they say the stye hasn't gone away, I give them the option of surgery, but I tell them that if it were me or my family that I would wait. There's no harm in waiting. There are some styes that just take more than a couple of weeks to get better. It may take a month or two. If you're willing to live with the appearance of the stye, I would encourage you to do that. Because it is a surgery, and even though it's a minor surgery, it does involve some discomfort. It does involve sometimes some bruising. It does involve taking time off from work, and it's not particularly comfortable. So what I would suggest is giving it time.